Welcome back. We're talking about oxidative therapies with Dr. Shallenberger. Dr. Shallenberger, in your practice, I see heavy metals quite commonly with patients testing them. I assume you see the same thing out in Nevada.
I test all my patients' mitochondrial function, every single one that walks in the door. They'll let me do it.
Yeah.
I'm going to put them through a test where we're going to see how efficiently they're extracting energy from oxygen.
Well, take us through that test because that is unique. I mean, that's not something that obviously is done widespread. You pioneered that to some degree?
Yeah, it's you know I did pioneer, but it's a pretty easy thing in concept. It's not like a big deal or anything, but basically we use some instrumentation that's already out there. That imagine I put a mask over your face, and as you breathe through that mask, there's a transducer device in there that actually computes how much oxygen is going into your body and how much carbon dioxide is coming out of your body. Now we look at that ratio because here's the deal. If you're extracting energy efficiently from oxygen, there will be less carbon dioxide coming out for the amount of oxygen going in. So you look at that ratio. And so we do that with you sitting, and then we put you on an exercise machine and we make you exercise, and we look at how efficiently you're processing oxygen through all the various levels of activity.
Now, is that being done, you know, for example, you see athletes on TV, they're going through training camps and being assessed. Is the type of version of that being done with these athletes?
Yeah, this is the kind of thing that you would do with an athlete to help to determine your training and your level of fitness. But it's something that you know really hasn't been looked at much for just general health purposes.
Well, like you said, whether someone wants to prevent disease, they have a chronic disease, they have to utilize their oxygen properly in their cells. So you're using that concept to apply to everyone. Which makes sense.
I'll tell you an amazing thing. Now, we've been doing this for close to 15 years now. We've done it on hundreds, if not thousands, of patients, all ages, all kinds of conditions. Some of whom had a lot of disease, some of whom didn't have any disease at all and were essentially healthy. Yeah. And in all that time, I have never once seen anybody that had efficient energy production that was sick with anything. Period, across the board. And I don't care how old they were. And conversely, anybody that came in to see me that was sick with either cancer or heart disease or diabetes or whatever, you name it, and I measure their energy production efficiency, I have never seen it be at optimum, ever. This cuts right down to the very core of what's causing disease. At some point, I'm going to get old and feeble, and I'm going to die. At some point. That point is going to be determined by how efficiently I process oxygen. If I process it really efficiently and I'm 95, I'm not too close to dying. But if I process it poorly and I'm 62, I'm at risk.
Yeah, makes sense. Let's go to the next step. I know you're a big fan of using ozone. Now, to the viewers out there, they've probably heard of ozone for disinfecting water and things of that nature, but it actually is a very, very powerful tool in medicine. Why don't you tell the viewers what ozone really is, you know, in simple terms, and then how we use it medically to help people.
Yeah, it's an amazing story. Ozone is basically 3 oxygen atoms. Now see, an oxygen atom can't exist in nature by itself. It's not balanced. Molecules need to be balanced in the sense of their electrons and neutrons. So there's just not enough electrons in an oxygen atom for it to be happy. So what it's immediately going to do is it's going to find another lonely oxygen atom, and they're going to team up and they're going to share electrons, and they're going to be a very happy little couple. If I take oxygen and I treat patients with oxygen, it is not going to improve energy production efficiency. They already have that. We're already breathing that in.
Right.
It is not going to improve because it's not energized enough. But here's the deal. If I take those 2 oxygen atoms tucked together, we call that O2, that's in the air that we breathe, and I break them apart and reassemble them into O3, now I have 3 oxygen atoms all sharing the same amount of electrons that makes 2 oxygen atoms happy. There's just not enough electrons to go around. And that's ozone, by the way. It's 3 oxygen atoms sharing the amount of electrons that makes 2 oxygen atoms happy. So what wants to happen is we want to get rid of that 3rd oxygen atom immediately. So now when I treat you with that, whether I inject it into you, whether I expose your blood or body tissue to that 3rd oxygen atom is instantaneously going to react. And you know what it's going to do? It's going to cause your body to utilize oxygen more efficiently. And it's just like a miraculous thing. They've been using it in Germany therapeutically for almost half a century now.
Right.
Yeah.